So the illness we're talking about today belong to endocrine systems disorder. Endocrine systems disorder relationship with body metabolism disorder. So that's basically for today. We have a lot of illness in these like systems, but we pick up one pretty common illness we discussed. So diabetes. Diabetes mellitus, usually we just use short name diabetes, is a pretty common illness. Lot of people have this illness. So what means diabetes? So diabetes basically people have disorder endocrine systems. Their glands couldn't secretion insulin. So we just finished digestion system last week. We know we have pancreas. Pancreas belong to two systems. One part is endocrine system. Another part is digestion system. Last week we finished digestion system part. Before we talk about endocrine system part, is a group of glands in each of the center of the isolate. And they have different cells, alpha cell, beta cell, and delta cell. So basically, beta cell. So put your name in the chart part during our break. So otherwise, I think you may have some questions. So basically, we say pancreas belong to two systems, belong to endocrine system. Thus, we have beta cell. And the beta cell, the secretion insulin. So these kind of patients, the insulin secretions got some trouble. Then we're talking about insulin control blood sugar level. Generally say they decrease blood sugar level. So insulin abnormal usually is decreased amount. Insulin's action is decreased blood sugar level. When insulin amount secretion is decreased, blood sugar level will be increased. So that's basically for this kind of patient, they will have troubles like glucose levels increase. And follow glucose level increase, they may cause lot of other issues like blood vessel disorder, eye disorder, lymph disorder. So that's basically. And for diabetes, basically, we have two different types. type 1 and type 2. Generally say type 1 kind of patient usually is genetic problem. Thus, generally say more severe kind of type. Their pancreas or their beta cell totally couldn't segregation easily. So they must be for injection insulin for all life. Type 2 kind of diabetes. Thus, usually patient may be coming from like after other illness. Then they got type 2 or maybe have some like overweight. Then they got type 2 kind of diabetes. So these kind of patients, they may just using blood sugars got some trouble. They may not necessary to inject it to insulin. So that's they say no insulin dependent diabetes. But they still need treatment. Still severe case cause the other symptom disorder. What's the medicine diagnosis for diabetes? So basically we say these illnesses, the main problems is plasma sugars level or glucose level is high. So that's a clear diagnosis. We need a test for glucose levels in the plasma. So that's basically our normal number is around 120. We have like a small different space here. It's over 140, then they make diagnosis. Or maybe 70.8 more, then they make diagnosis. So that's pretty clear diagnosis if the patient's plasma glucose level is increased. These kind of patients, usually, they have some symptoms. So basically, we can think about 3 more one life. So what's the 3 more for diabetes kind of patient? Eating more. Always hungry. Always try to eat something. And drinking more. Always thirsty. Always try to drinking water. But after drinking, they couldn't hold in the water. They pee a lot, urination more. So that's basically for the patient have diabetes, they have 3 more symptoms: eating more, drinking more, and urination more. One life. What's the one life? Body weight loss. Even they eating loss, but they still didn't got body weight. So that's the typical symptoms for diabetes kind of patient. So if patient have typical symptoms, then go to blood test. Then if we finding glucose level is above the normal, then people got diagnosed. So that's most people like when we diagnose. But truly, some people, they may couldn't get a clear diagnosis. For example, we say typically symptoms, 3 more. They may just have 1 more or 2 more. And the body weight not truly lost too much. And the test for blood glucose levels is kind of between normal and high. So for this kind of patient, we can go to another basically the test, like a give patient have some glucose early taking and then to see what happens truly in the blood glucose level. So that's by Western medicine diagnosis. So diabetes is pretty clear, can make a diagnosis right now. And the treatment for different type of the diabetes or treatment may be different. We're talking about type 1. That's usually coming from genetic disorder. Their insulin secretion, so pretty severe kind of abnormal, or even the beta cells couldn't release insulin. So this kind of diabetes truly need insulin kind of treatment. We know some diabetes kind of patients. They test their blood glucose levels like 3 times each time before the meal. Or maybe some people just test 1 time and then they control the amount usually video injections. But generally speaking, each time before they eat it, they must be injected for insulin. So that's a severe kind of case. Almost type 1 kind of diabetes. Other cases, especially type 2 kind of patient, they're like pancreas beta cells still can secrete insulin, but the body couldn't use it properly. So that kind of patient, basically, insulin injection is not really working because the body couldn't use it. So basically, more important aspect, control the food they eat. We're talking about less sugars and less rice kind of food because that still contains lots of sugar inside. Can use like we're eating more protein and more vegetables. Certainly, we couldn't totally stop eating sugar products, but truly decrease the amount and control the amount they eat. And also, we have some like early take kind of medication to help to control blood sugar level. So that's basically Western medicine kind of treatment. People getting overweight pretty easily got type 2 kind of diabetes when they control what they eat and plus some exercises. Some people diabetes truly can recover. Then we move into TCM. TCM illness name mainly we call 消渴. 渴 people thirsty. Severe kind of thirsty. So that's 闷累 certainly by the different symptoms. They may give different names. So generally say, we say diabetes, they have 3 more symptoms. People drinking more, thirsty, try to drinking more. That we call 上焦. Yeah. Means upper, yeah, in the upper jaw. And the people perform more drinking, yeah, drinking more water. And the people eating more. People eating more, usually we call 中焦. Means middle burner disorder. People perform more eating. And the people urination more. That we call 下焦. Lower jaw disorder, performing more urination. So that's for TCM clinically, pretty commonly, we call it 消渴, but we can separate with 上焦, 中焦, 下焦. Means which symptom is more severe compared with other 2 symptoms. Then we go to different part, and our treatment we still follow different patterns and give patient the treatment. The first pattern we talking about lung and stomach heat accumulation and cause the body fluid damage. Heat always damage body fluid. So in this pattern, people mainly severe kind of thirsty. They still try to drink loud, but they still got a dry mouth and a dry tongue. So still have urination frequently and a big amount. So we say patient usually have 3 more symptoms, but for different patterns, different patients, they may 1 or 2 more symptoms there, more severe. So patient tongue is red on the side part and side part and the yellow coating. Pulse is rapid, surging, yeah, pretty strong. So that's this pattern, yeah, this pattern. We mainly thinking about belong to upper jaw or 上焦. So that's basically key symptom or mainly symptom is thirsty and drinking loud. So this kind of pattern usually happens in the early stage. Yeah, early stage kind of diabetes. Patient maybe don't have other symptoms, but just thirsty, always try to drink water. After drinking water, they still feel dry mouth and dry tongue. So our treatment pencil, certainly we need clear heat. We say that heat mainly in the upper jaw and the middle jaw, and then generate some body fluid and stop thirsty. So that's the formulas we use. 养阴清肺康 plus 养 is nourishing. It's not yang here, yeah, different Chinese character and different tongue here. Yeah, yang, third tongue, third tongue. Yang is second tongue. That's nourishing or tonified. Yin is in body fluid, belong to yin. That's heat damage body fluid already. And qing means clear. We say clear heat. Heat 门雷音的浪，肺的浪。康 is decoction. So that's the formula we mainly use for this pattern. Acupuncture we use. So 出来 heat pattern we are not use massage. And the acupuncture points, we use stomach 44 here, clear heat. We say this heat in the lung and the stomach. So we use stomach 44 to clear heat. And also lung 5 can clear heat also. Clear heat from the lung and moist in the lung. Kidney 7, we talked about a few times when this point already. 浮流, fu means double, 流 means body fluid. 出来 it generates body fluid point. So we can use it for people sweating problems, spontaneous sweating and night sweating. We also can use to generate some body fluid, like a patient have severe kind of thirsty kind of condition. So that's this part we're talking about. And then another pattern, still stomach heat, but let it be more severe. So that causes people not only thirsty, but hungry and eating lot. Certainly, patient may still have symptoms, thirsty and appear loud, but mainly is more hungry, more eating. And they eating loud, but the body weight losing and got emaciated. So that means what are they eating? They are not truly used by the body. And their stool is more dry. So still some heat set in there. And even the heat set even more severe. Right hand yellow tongue coating, that's usually internal heat. And the sleepy pulse, bigger, larger same meaning, bigger, and the forceful pulse, that's excessive heat. So that's the pattern mainly we call 中小, middle 小, mainly key symptom is eating. Treatment principle, we clear heat from middle jaw mainly. And then we try to moisten intestine because they have dry stool in there. The formula we use 厌食中消放. This formula not in OCPM. So basically, 中消 is middle 焦, diabetes or 消渴 from this formula. 厌食 食 is eating. So basically, we try to reducing people's eating and treat middle 焦消渴. The acupuncture treatment. So we still not use Marxafer in this case because heat there. But we still use stomach 44 to clear heat from middle jiao and kidney 7 with regular water or promoting more body fluid. So stomach 36 here, generally 25 T, 25 blood. We're talking about this kind of patient. They eating lot, but their body fluid is losing. So that means nutrition not fully sending to all our body. So still got generate T blood difference here. So we need more tonified. We still can use some other points. We still can use some other points to help clear heat or maybe help regulate water. So that's by patients different symptoms, we can add more points. Then we're talking about pattern. T and yin both difference. So we're talking about two patterns belong to excessive pattern before. Now we're talking about differential pattern. So differential pattern usually patients getting sick for long term, or maybe originally have some differential kind of situation, then plus self-correct. So T deficiency can cause patient fatigue and short breath. Yin deficiency can cause patient like a dry stool, night sweating, or night urinations, and emaciations that coming from yin deficiency. And also possible have other symptoms. Yeah, 500 heat, insomnia, dreams, so that's some combination Qi deficiency and yin deficiency symptoms together. And then patient search. So these deficiency kind of patients, they still thirsty, but each time they are not drinking too much because deficiency. The tongue body depending is more Qi deficiency or more yin deficiency. More Qi deficiency may cause the tongue body more swollen. More yin deficiency cause tongue, right tongue without coating, or this little bit coating. And the pulse always thin and weaker. Could be rapid pulse, is more severe yin deficiency. So our treatment pencil for these pattern 25T generate body fluid and nourishing relieve dryness. The formula we use 玉叶汤. Here is kind of leaf. 玉 is Judy. We know the Judy usually is cooling natural. So still some heat inside. But I don't think this formula is CPM. Acupuncture treatment. So basically, for this pattern, we need to see is more qi deficiency or bone yin deficiency. More qi deficiency with the adding marks on there. More yin deficiency, if still more heat, we may not mark on. It's totally depending on the situation. But truly, we need more tonify and nourishing points, and also regular work. Some by 2 points you can work. Rather 20, especially for some T25 and some Ren points which you can use. Ren 6, Ren 9, which you can use. When we're talking about the pattern, mainly kidney, these patterns generally belong to lower xiao. This is xiao ke. We have upper xiao mo drinking, middle xiao mo eating, and the lower xiao mo urination. So filtered urination and the fecal possible to breathe. And especially urination at night. The urination amount, big amount, then the mouth will be more dry. And certainly patient may have some other symptoms for kidney, like lower back pain, knee weakness, and maybe sex function, tinnitus, decreased hearing. So lot of also because of ear is the kidney open. So lot of ear symptoms. The tongue is right tongue, and maybe without coating, or maybe yellow coat, but generally it's dry. The pulse still thin, but more tight or varying. So that's we say this pattern we call loss. Our treatment principle certainly we need the nourishing of tonified kidney and the nourishing yin. And the formula we use, 地黄丸 we pretty familiar already. We talked about this time. 麦味地黄丸，麦门冬五味子 plus 地黄。So that's more nourishing for the kidney formula. Acupuncture treatment, we mainly kidney tonify. Kidney 3 yuan south points of the kidney. And the kidney 7, we're still talking about double regulating the body fluid. And the backroom of the kidney and the yuan south of the lung. Remember, when we learn the foundation, we say lung have functions, regular water passing. So basically, lung have dispersing function. They located in upper jaw. They will send in the body fluid everywhere. So that's why we go to yuan south points of the lung and we need all that. So in difference, view depending. If severe heat there, maybe not good for mouth. It's not severe heat there. we still can do maxa for tonify. Maxa generally say is better tonify than needle. Then we go to the pattern. Key difference. With stomach, we put together, thus belong to middle ear. So this pattern, because patients have spleen key differences, their appetite may be low or poor appetite may be normal. But they still more thirsty. And the most case, most patients may be losing sleep. And they may have abdominal distension. Their body weight will lose that initiation. And weaker on the falling fatigue. So that's coming from spleen T difference. Spleen control the falling and control the muscle. When spleen T difference, the muscles weaker, the limbs weaker. 糖 is 票糖 and usually 糖 coating this one, still white coating. The pulse is thin pulse and faultless because difference. So our treatment for this pattern, tonify the spleen, tonify T, and the mainly symptom for this pattern, people thirsty. People thirsty because the spleen TNT not working. They drinking loud, but they not truly sending body fluid to our body. So that's why patients drinking loud, still thirsty, still drinking, but the body don't have enough nourishment. So that we tonify spleen function and make the TNT working, then stop thirsty. So the formula we use, 七味白毒散 modified. These formulas still not in our list. So if you are interested, you can see the book with ingredients in it. But generally, they have tea, mainly tea, tonify, herbs inside. So for acupuncture and the massage, truly tea difference pattern, massage is good way. More tea tonify. And the points we know we have pretty good points for tea tonify. Stomach 36 and 36 and Ren 6. Especially Ren 6. Tea high, C of the tea. That's pretty good point to tea tonify. And the spleen 3 Yuan South points of the spleen. Certainly we can add in back 2 points, like bladder 20, more tea tonify. And we also can add in back 2 of the lung. We say we have 2 organs control all over body T. One is the spleen, one is the lung. So when people have T difference kind of situation, if we diagnose for lung T difference, we still can same time tonify spleen T. if we diagnose for spleen qi differences, we still can same time tonify lung qi because these two organs pretty close relationship with each other. And in 5 elements connection, spleen is the mom of the lung, lung is the son of the spleen. So now we can tonify together. When we're talking about pattern, dam heat blocking the center. Center here still means middle. So patient thirsty and like to drink more water and also eating more and hungry more. Or maybe sometimes people feel hungry. They may not eating too much. And also, possible we can hear some sounds in the abdominal area, and the people maybe have nausea. So some blocking. They try to eat more, they try to drink more, but not too late. Digestion. The tongue is yellow tongue coating, that means some heat inside. And the slimy tongue coating is some damage. Soggy, the semi-softer pulse, or sleepy pulse, still coming from damage. Rapid coming from the heat. So that's the pattern. We say this pattern pretty possible follow spleen qi difference pattern. We say spleen qi difference, T and T not working. When T and T not working, it's blocking here. And the blocking can cause some damage combination with the heat. So treatment pencil for this pattern, clear heat and remove damage. The formula we use 黄芩滑石糖 modify. 黄芩 clear heat verb. 滑石 still clear heat and also promote urination, remove some damage. So that's basically for this pattern formula. Acupuncture treatment. So with heat condition, we are not using Moxa. And basically blocking in the middle jaw, we use 人教 regular middle jaw, open middle jaw there. And the stomach 44, we still use for clear heat. So this heat mainly still in the middle jaw, in stomach. So that we go to stomach channel, these 2 points to clear. And the spleen 9. Spleen 9 remove damage. So that's the combination together we use. So that's for the acupuncture treatment for this pattern. Then we're talking about pattern. We say spleen qi yang difference. Yang difference generally say patient will have qi difference symptom and plus cosine. That's usually we're talking about yang difference. And all our body yang is controlled by the spleen and the kidney. So that's we put spleen and the kidney together here. But truly, clinically, maybe sometimes people more severe spleen yang disease. Some people may be more severe kidney yang disease. So to see what's the symptoms. So basically, patients still have 3 more symptoms, but maybe not severe. Typically, for one is more severe compared with other one, but they have cold signs, aversion to cold, or maybe chill in the body. And the qi deficiency symptoms, short breath. Patients have kidney yang deficiency. They will have lower back pain and knee soreness, and maybe tinnitus, deafness, and frequently clear urination. Patient most spleen yang deficiency, they will lose stool. Yeah, even kidney yang deficiency still possible losing stool. And tongue, tail tongue, and swollen because yang deficiency couldn't relieve extra water, caused water retention inside, and moist skin kind of tongue coating. The pulse is deeper and thin and pretty weaker. Yang deficiency, yang deficiency. Patient's pulse is more weaker, And we're talking about especially weaker in the chi position. So we're talking about pulse. We're talking about the chi. One. Chi. This side is the hand. So that's we say here means upper position. Here is the middle position. Here is the lower position. Like put your hand over your head, then upper, middle, low. So chi position means T. So that's we say this pattern usually happens in the aging people. We're talking about over 50 years old. So for TCM, we have different like time circle relationship with body functions. For female, 7 times 7. For the male, the man is 6, 8 times 8, up to 64. So that's different time circle for female and male. But generally speaking, when people get over 50 or 60 years old, they must have some kidney deficiency. So then they got a lot of other trouble. So treatment principle, certainly we need warming. Yeah. Warming kidney and spleen yang. And we regularly yin and yang, bring it back to the balance. We use 2 formulas for this condition. 健脾丸, that's one formula. Mainly working for the spleen, P is spleen. Here is tonify, or make it strong. And Jia means blood. 应对肾气丸为 pretty familiar already. Thus, Qin Yang tonify form. So for spleen and Qin Yang, deficiency and condition. Acupuncture treatment. Maxa. Food choice. Yang deficiency, always thinking about the maxa. Warming. And very important, go to maxa. The points we can use, 人 for and do for. So do for we call 命门. What means 命门? 阴阳 point. Patient with yang deficiency, certainly we can specially go to 阴阳 point to tonify it, and even with maxa. And 人 for, or originally 元气 located. Patient have yang deficiency, well, including qi deficiency. You can go for maxa, middle or maxa. And the kidney 7, we still regular water there and also working for kidney. And spleen 6, working for 3 in organs, middle jaw and the lower jaw, liver, spleen, and the kidney. Another good point for maxa, 人 8. Ren 8 body body. We say we are not needle there, but that's a pretty good point. We do maxa there. So basically, if we do maxa on Ren 8, we can do indirect maxa, like a belly button or Ren 8 here. We can put something like a salt over the belly button, and then put the maxa over it, burning the maxa. After maxa totally burning off, people still can feel heat from the salt, and still can work. So why we use salt? Salty flavor go to the kidney. So that's why we can use salt for maxa for Qin Yang deficiency. Certainly, you can use some other warming herbs putting there and still can help, like Chinese herbs. Is pretty warming herb. So cut piece of food and then put in there for the maxa about it. Body butter is not a lot either way. We do directly maxa. So directly maxa, we directly put maxa on the skin. But body butter is a David there. It's not truly working for directly maxa. But we can do lot of indirect maxa. So that's part. So that's basically for these illness. So diabetes is kind of complicated illness. And the clinical treat with the combination acupuncture with some herbs will get good result. And also something need to be careful, help patient, reducing eating sugar and sugar products, because that causes more trouble for the patient. And try not eating junk food. So basically, we can encourage patients eating some snacks like of protein between the meals. Otherwise, they may hungry. But don't eating sugar. Don't eating sugar products. And certainly some others, generally we just follow patients eating. Generally just try to avoid like simple sugar products. And encourage the patient do some exercise, control body weight, and don't drink alcohol, less coffee. So that's basically pretty important part about the diet, about diet side. That's no important part. It not means with acupuncture and massage or even herbs treatment, people can still eating everything they like. So control food, control different kind of food. That's pretty important for the patient. And most people for diabetes, they may have different degree kind of green tea deficiency. And also maybe can generate some heat in the middle there. And maybe with some underlying body condition, kidney disease. So truly, clinically, we need to see individually patient's conditions and then to see what's the pattern. Then we go to like combination treatment, like the herb with acupuncture together. So that's basically. And like we talking about patients sick for long term, or maybe patient getting aging, they may pretty possible have both tea and young differences. So we need to see that pattern and the patient